Welcome, friends, to this first anniversary special session of She and Rights. Let us open today's session with a message from Dr. Tlaleng Mofokeng, the United Nations Special Rapporteur on Right to Health.
I'm very delighted, dear colleagues and friends, to be part of today's She and Rights session, which has been organized in the lead up to Safe Abortion Day, World Contraception Day, and the upcoming 80th session of the United Nations General Assembly in New York City. This is also the 1-year anniversary of the She and Rights Media Initiative, and congratulations to all. And there will be an award ceremony for the journalists from this year's cohort at ICFP in Bogota this year in November. Sexual and reproductive health rights are an integral element of the right to health. Yet we know when we are speaking specifically about abortion care that obstacles exist, they are interrelated and entrenched, and operate at different levels in clinical care, at the level of health systems, and in the underlying determinants of health. Abortion is healthcare. Access to abortion is a human rights issue, full stop. Safe abortions save lives, and it is an essential component of sexual and reproductive health provision and central to one's reproductive autonomy and freedom and bodily integrity. Discriminatory practices and laws not only violate women and people who require abortion's rights, but also contribute to poor health outcomes which exacerbate existing health inequalities. And this is true for LGBTQA+ persons who may also require abortion services. I've also recently launched a sexual and reproductive health rights strategic litigation report, which I hope will go a long way to help all of us firstly clarify, enforce, or challenge any legal standards and policies that violate our human rights to sexual and reproductive health rights. At its best, of course, we know litigation centers the voice and needs of affected people. And so it is important through such dialogues as today, as we are in an era of coordinated global efforts to roll back reproductive health rights, we must be united. We must be clear in our demand that abortion access is a human rights issue, that indeed LGBTQA+ communities as well require particular health needs, including abortion rights, and that in my capacity as the UN Special Rapporteur on the right to health will continue to assert that reproductive health and sexual health are a state of complete physical, mental, and social well-being, and not merely absence of disease. And so with that, I wish to say happy Safe Abortion Day. We appreciate all abortion providers, and World Contraception Day as it comes. We wish for comprehensive services for everyone everywhere, and I look forward to seeing some of you at the 80th session of the UN General Assembly coming up in September and in October. Thank you very much, colleagues.
Thank you very much, Dr. Tlaleng, for this powerful opening message and your rock-solid support to gender equality and human right to health. Friends, let me now share a few highlights of our 1-year hosting of She and Rights, that is Sexual Health with Equity and Rights sessions with you all. Just a moment, please. When I look back, the feminist movement stands out as one of the most progressive ones over the years. How can we forget the International Women's Day came into being in the early 20th century? That was 1909. How can we forget those who thought of a legally binding UN treaty in 1945 and pushed the government to finally agree on CEDAW that is Convention on the Elimination of All Forms of Discrimination Against Women in 1979. Then we have the history of ICPD, the International Conference on Population and Development, and its Program of Action 1994, the Beijing Declaration and its Platform for Action 1995. Also, the legally binding Maputo Protocol in Africa. Excuse me. The legacy of the feminist movement gives me tremendous hope, resilience, and power to keep fighting for our rights, no matter come what. But despite progress made over the decades, there are unkept promises and our own lived experiences of facing gender inequalities and injustices, which are a living testimony, reminding us that we could have done better. Manipulative, sinister, patriarchal pushbacks have resulted in unsatisfactory implementation on the premises made for gender equality and right to health. The regressive Geneva Consensus Declaration and the Madrid Commitment are just a few examples of it. We felt a growing and acute need for sustained media engagement on gender equality and human rights to health a year back. In September last year, CeHDI and CNS and partners, IPPF, WGNRR, Arrow, and APCAT Media came together and launched the She and Rights Initiative ahead of Contraception Day and Safe Abortion Day 2024. She and Rights was launched to increase media engagement around sexual and reproductive health rights and justice, or SRHRJ as we call it, with the lens of equity and human right to health. Media and people from several other sectors, mostly from African and Asia Pacific regions, have been engaged since the first session onwards. Over the year, every month or fortnight sometimes, we have hosted She and Right sessions to focus on a range of current issues related to gender equality and right to health, especially in the context of Global South. From abortion rights to Beijing Plus 30 regional review in Asia Pacific and Africa, from focusing on persons with disabilities, sexual and gender-based violence, NSR-HRJ, to young people and SRHRJ. Thanks to CeHDI for hosting side event around the 69th UN Commission on Status of Women, or CSW 69 in New York, focusing on conflicts and other humanitarian crises, gender equality and human right to health, hosting side event at the 78th World Health Assembly, WHA 78, focusing on the disappointing outcomes of the 4th Conference of Financing for Development, and collective advocacy for fully financing gender equality and right to health, contextualizing latest HIV data and voices of key populations, young people in all their diversities, indigenous peoples, and of course, raising our tempo around upcoming the 80th UN General Assembly and Contraception Day and Safe Abortion Day 2025 today, and calling upon governments for greater action to stop anti-rights and anti-gender pushbacks and to walk the talk on SDG 3 and SDG 5. Here is a spotlight. In the last 1 year, around 1,700 people joined She and Rights. Thanks to each one of you, we are stronger together. 144 media people joined the She and Rights sessions. Thanks for your gender-sensitive and rights-based coverage. And this resulted in over 650 unique media news URL or links in 27 countries worldwide and media coverage in 5 languages. Our special gratitude to around 70 speakers of She and Rights sessions in the last 1 year. Shukran and muchas gracias. These are our speakers whom we hosted and who agreed to speak during this year. Thanks to all of them. Thanks to the participants, media people, and their media outlets for sustained and growing gender-sensitive and rights-based coverage. She and Rights also hosted the first edition of the She and Rights Media Awards ceremony around the 78th World Health Assembly in Geneva. Congratulations to all awardees and all media people who helped amplify gender equality and right to health. The second edition of She and Rights Media Awards 2025 was announced in July 2025. Last date to apply for these media awards is 15 September 2025. As Dr. Tlaleng had mentioned in her message, the award ceremony would be held at ICFP 2025 in Bogota, Colombia. Thanks to CeHDI, the first prize winners from African region and Asia Pacific region would get to go to ICFP 2025. Apply now. The link is on the slide. Our heartfelt gratitude to CeHDI and all partners who have joined hands to host She and Rights over the last 1 year. Some like IPPF, WGNRR, Arrow, and APCAT Media have been with CeHDI and CNS all along, and some joined hands for specific sessions. Thanks to each one of you. Let me now invite my friend and colleague, Kelcey Armstrong-Walenczak from Global Center for Health Diplomacy and Inclusion, or CeHDI. Over to you, Kelcey.
Thank you so much, Shobha. And hello, everyone. Thank you all so much for the opportunity to join you today. My name is Kelcey Armstrong-Walenczak, and I am the Senior Advocacy Manager at CeHDI, the Global Center for Health Diplomacy and Inclusion. It is my very great pleasure and honor indeed to address you today as one of the co-sponsors of this important initiative and this session. CeHDI is an international think tank and policy broker based in Geneva, Switzerland, with a mission to advance the right to health as a gateway to global health equity. We work to ensure that the right to health, as enshrined in international law, is not treated as an abstract principle, but as a living commitment that must shape real policies, real services, and real outcomes for people everywhere, particularly women and girls. We do this by building bridges. We forge and support South-South and North-South partnerships. We create safe spaces for like-minded diplomacy efforts, and we provide governments with evidence, arguments, and case studies that help them fulfill their obligations under the right to health. The right to health, as recognized in the International Covenant on Economic, Social, and Cultural Rights, and reaffirmed through multiple international agreements, places 3 fundamental responsibilities on states: to respect, to protect, and to fulfill. Respect means removing the legal and practical barriers that prevent people from accessing services, including restrictive abortion laws, unnecessary medical authorizations, or stigmatizing procedures. Protect refers to safeguarding individuals from discrimination, coercion, and violence. And fulfill means actively ensuring that the full range of health and services, including comprehensive sexual and reproductive health care, are available, accessible, acceptable, and of good quality. Safe abortion care sits squarely within this framework. Without it, the right to health cannot be fully realized. We're gathered here today in a global health landscape that is more challenging than at any point in recent memory. Around the world, we are witnessing the rise of regressive policies that roll back hard-won rights. We're seeing a retreat from multilateralism at the very moment when global challenges most require global cooperation. We face increasing politicization and polarization of health issues, as well as anti-science rhetoric that undermines evidence-based policy. These trends, as you all know, have real consequences. They cost lives, they deepen inequalities, and they weaken the credibility of health systems and trust in governments as providers and protectors of health. We need an urgent reset to reframe action through the lens of the right to health. Sexual and reproductive health and rights are not optional. They are not negotiable. They are obligations under international law, and they are essential for advancing equity, dignity, and justice, particularly for marginalized groups, including women, young people, and the LGBTQ community. They also bring wide-ranging benefits: healthier communities, stronger economies, more resilient societies, and greater equity and stability. Their implementation creates opportunities for development and enhances health sovereignty within and across states. At CeHDI, we have been honored to support the She and Rights Initiative over the past year, amplifying youth voices and grassroots leadership in these spaces, while supporting the capacity of journalists to counter the tidal wave of anti-rights narratives in dozens of countries around the world. And we are especially excited to be supporting the participation of the She and Rights Award winners at the International Conference on Family Planning in Bogota this November. ICFP will be another crucial opportunity for us to strengthen our alliances, share knowledge, and chart the way forward together. We invite all of you to join us there at our CeHDI side events to grow our network and to carry forward this momentum well beyond today's session. Advancing the right to health is a shared responsibility. Ensuring access to safe abortion is not only a matter of legal obligation, but also of sound public policy and effective governance. We believe that progress comes from dialogue, evidence, and cooperation across sectors and regions. We're committed to working with governments, multilateral organizations, and civil society to translate evidence and dialogue into effective action and stronger health systems. So thank you again for this opportunity to contribute to the important conversation today and beyond. We look forward to deepening our collaboration in the months ahead, whether here at ICFP in Bogota or in other spaces where global health diplomacy can help us drive towards inclusive and equitable solutions. Thank you so much, and back over to you, Shobha.
Thank you, Kelcey. And I would now like to invite another She and Rights co-host organization from the very beginning. I'm happy to have with us today Tomoko Fukuda, who's from International Planned Parenthood Federation, and she's Regional Director, IPPF, East and Southeast Asia and Oceania region. Over to you, Tomoko.
Hello, hello, Shobha and colleagues. It's so nice to meet you all. I don't have a written speech, so to say, but wanted to just join the other voices and fully support what has been said so far. You know, we are facing so much opposition. It is getting stronger. They are much more organized. We are seeing a pushback on development and aid. We're seeing more conflict around the world. I cannot agree with all of you more on the challenges we see in the horizon. But I think efforts like this is what keeps us going. I really want to thank CNS Shobha for leading such kind of partnership and collaboration. You know, this is the kind of thing we need at a moment like this. We cannot be seen as small dots on a large plane. The more we hold hands, the more we come together, the bigger the movement we can be, the louder our voice can be, and definitely we can make a bigger mark. So congratulations on this first anniversary. I've seen your efforts throughout the year on organizing events, helping us to come together. Thank you so much for your hard work, and I look forward to much more. Thank you. Back to you, Shobha.
Thank you very much, Tomoko, and thank you for all your support. And yes, together we can. Together we will be able to achieve our dream. I'm sure of that. Let us dive straight to today's She and Rights session on the theme of abortion rights are human rights. And this is being hosted ahead of the 80th United Nations General Assembly, or UNGA, and the Contraception Day, which is on 26 September, and International Safe Abortion Day, which is on 28 September. We all support the call for accessible, safe, legal, and stigma-free abortion care for all. Abortion is essential, life-saving, sexual and reproductive health care, a fundamental human right, and central to reproductive freedom and justice. It is also a cornerstone of gender equality and a critical component in achieving the SDGs. Yet, today we are witnessing a coordinated backlash against abortion rights, reproductive justice, and broader human rights movements, including gender diverse peoples and feminist movements. With less than 64 months left to deliver on the SDGs, we have a vital opportunity to straighten our movements, amplify our demands, and push for concrete, transformative action to advance reproductive freedom and justice through intersectional, intergenerational, and cross-movement solidarity. We demand governments must make abortion, including abortion self-care, safe, legal, available, accessible, and affordable, by eliminating all laws and policies that restrict or criminalize access to it. I'm referring to the Global Declaration on Abortion, the Nairobi Summit on ICPD 25. This 13th session of She and Rights is co-hosted by Global Center for Health Diplomacy and Inclusion, CeHDI, International Conference on Family Planning, ICFP 2025, Family Planning News Network, FPNN, International Planned Parenthood Federation, IPPF, Asian Pacific Resource and Research Center for Women, ARROW, Women's Global Network for Reproductive Rights, WGNRR, Asia Safe Abortion Partnership, ASAP, Asia Pacific Media Alliance for Health and Development, APCAT Media, and CNS. Another speciality of this session is that all our speakers for today have spoken in the She and Rights sessions in the past year. And I also see so many participants online who have been regular supporters of She and Rights. Thanks to each one of you. Welcome, friends. A few quick housekeeping announcements before we begin ASAP. Participants, please keep yourself muted throughout the session. You can type in your questions and comments and reflections in the chat box while the speakers present. We will take up as many relevant questions as possible after all speakers have presented. I now invite Nelly Munyasia, Executive Director, Reproductive Health Network, Kenya, to update us on the progress and challenges around abortion rights in Africa in making contraception and safe abortion services accessible to all those who need it, and also threats of anti-rights and gender pushes in the African context. Due to some last-minute changes in her flight schedule, Nelly has requested to speak before our keynote speaker, Dr. Mabel Bianco, and I hope Mabel will forgive me for this. Welcome, Nelly.
Oh, good afternoon, good morning. Thank you so much. And Mabel, my apologies. There was a bit of confusion, and thank you, Shobha, for being very flexible. I'm really excited to be joining this really powerful session that just comes a few days before we celebrate the Safe Abortion Day. My name is Nelly Munyasia. I'm the Executive Director, Reproductive Health Network Kenya, a member association of IPPF, but also leading a network of abortion providers in Kenya. And as a strong advocate and provider of abortion services in Kenya, but also in the region, I take cognizance of some of the, the regional human rights treaties that exist, and a lot of times we do not see an intentional support by our governments to ensure that they are implemented fully. So we have the African Commission on Human and People's Rights, African Court on Human People's Rights, and African Committee of Experts on the Rights and Welfare of the Child. That all assesses states' compliance with human rights standards, including by deciding individual complaints of human rights violation. However, the jurisdiction and activities of each bodies are distinct. We also have instruments that support SRHR in Africa, and abortion is part of it, contraceptives is part of it. I've talked about the African Charter on the Rights and Welfare of the Child, and then we have the African Charter on Human and People's Rights and its protocol on the rights of women in Africa. We have the Maputo Protocol and the Rapporteur, the UN Special Rapporteur mentioned about it. The African Union Continental Guiding Framework for Sexual and Reproductive Health and Rights that was developed back then by the African Union Commission in collaboration with UNFPA, IPPF, among other development countries, other development partners in the country. Specifically, we have the Maputo Action Plan 2016-2030 for the operationalization of the continental strategic frameworks for sexual and reproductive health and rights, and of course, the East African Community Treaty. When I will narrow down a bit to Maputo Protocol, which is really like, a binding instrument for us when we even fight a lot of restrictions when it comes to access to safe abortion services. For one, it recognizes the value of family, but also encourages the recognition of women's autonomy over their own bodies. importance of information and education and access to justice in SRHR matters. And I say this because I know every day we are fighting in Africa because of access to SRHR information, which is being considered as a foreign idea. And it's embedded in the Maputo Protocol very clearly. There's also the component of prevention of transmission of sexually transmitted infections. And then there's the importance of access to healthcare, freedom of choice when it comes to fertility and childbirth. The Maputo Protocol has been hailed as being the first, if not only, human rights instruments globally which allows abortion in explicit terms. However, we are aware that Africa as a continent, of course, we have countries that have put a reservation to it. When we narrow down to Africa, of course, we know that abortion continues to be one of the most contextualized, contested issue. We have countries, of course, that are very progressive. We have South Africa, we have Mozambique, and Tunisia that really have liberated access to abortion. But countries such as Kenya, where I come from, we have unrestricted laws, and abortion is only allowed under certain conditions. And this therefore makes it really difficult for us to continue to advocate for abortion even as advocates. Some of the challenges that we see, and I will start with what we all have said, we have a strong coordinated anti-rights groups that has decided to target, of course, the whole globe, but for Africa specifically, coming in with the language of attacking family values and wanting to define how family values look like. And they have infiltrated some of the critical spaces where feminists and activists and healthcare providers that champion for abortion services sit. And, they're part of the technical working groups where policies are being formulated. We are even seeing a push of them wanting to be part of the judiciary so that they can also legislate on some of these issues around where we have had providers being arrested or women being arrested for accessing these services. We are currently seeing them being very intentional in ensuring that they are even carrying out a surveillance on organizations or healthcare providers that provide safe abortion services, and they are championing petitions so that they call out, they recall very progressive legislators that support abortion, but also ensure that providers that provide abortion services are arrested or they are delicensed. And this we've seen in Kenya, where a few of our partners have been targeted. And this is because we continue to see a lot of weak, disaligned and unfavorable legislation and policies on abortion. We see lack of commitment to national and regional international obligations. And Shobha, you've just mentioned a lot of them, that where our country, we've seen Kenya being very intentional and other countries in Africa signing onto this commitment, but implementation continues to be a problem. There's the whole issue around stigma. Stigma continues to be the number one cause of women not being able to access these services and instilling fear in healthcare providers. And this is because of the narrative that the anti-rights groups continue to use, so that, they are instilling fear in women, but also to the healthcare providers. There's also the issue of the limited knowledge where, for example, in Kenya, we know the Constitution and Article 26.4 is very clear. It states, it gives the healthcare provider the power to provide healthcare services when the health or the life of the mother is endangered. It goes further to define who this healthcare provider is, but again, also defining health according to WHO. However, this is information that you will only find with a few institutions. For example, Reproductive Health Network Kenya that works with providers, and we are training the providers, MSI Kenya that will also be doing that for their providers, or IPAS. And this brings a lot, it leaves a big gap, especially for the providers that work in government facilities, which a lot of times they're the ones that come into contact with these women that are in need of these services. And for that reason, then this exposes the women to the increased maternal mortalities and morbidities due to unsafe abortion. And I would say also, the silent approach in activism when it comes to advocating for safe abortion services and family planning, and why opposition has continued to, unapologetically and boldly, push back on the progress we've made, is because you'll find civil society organizations that work around, for example, family planning. They will not want to touch abortion. And those that work around LGBTQ rights will not want to be involved, for example, in the narrative around abortion. And this then a lot of times has put healthcare providers in a very awkward situation, and they become targeted a lot of times because they're the ones that are, providing services to all these population when they come to access services. So really the siloed approaches to the work that we do as civil society organizations continue to also be a bigger problem. Then what we also see, of course, it's our culture and religious practices. But again, this is also part of the anti-rights groups that then they speak to our culture, speak to our religion, just to make sure that, they are creating that barrier to accessing services. And as a consequence of all these challenges that we see. Of course, there's also the issue of financing, because when we think about making these services available, the advocacy that goes into it, the supporting government to ensure that we have progressive policies, the creation of awareness, addressing social norms, all this needs financing. And we all have seen what has happened. We are seeing a lot of funding cuts left, right, and center. We are seeing reprioritizing in terms of what angle or what funding or what philanthropies want where their funding can go to. And so all this then, because of all this, of course, we continue to see a lot of increase in number of unsafe abortion services, an increase, of course, in maternal mortalities and morbidities. We continue to see a community that is not bold enough and brave enough to talk about issues to do with abortion or even access to contraceptives by adolescents, or even supporting the LGBTI community. And so what we are doing as Africa or as Kenya and other countries is we're being very intentional in movement building, so that we are collectively, coming together and speaking as one voice, intersecting SRHR, abortion, family planning, and LGBTQ rights, so that when we decide to address the issues around the anti-rights group, then we are doing it collectively and being very intentional in having a multi-sectoral approach where we are bringing folks from academia, from research, but also policymakers, the non-traditional actors, so that they're supporting us in championing and ensuring that we are creating an enabling environment for SRHR, but also for access to safe abortion services. Then innovation at this time and at this point in time where we have issues with challenges with financing, we are taking lead in ensuring that, self-managed abortion, for example, self-care. In Kenya, we are so proud that we have been able to domesticate the WHO 2019 guidelines, and we are having the reproductive health self-care guideline. And this is very critical because it's supporting us to give women the autonomy, but also allow them the agency to be able to manage their abortions at the comfort of their home. But also, we also have the self-injectable contraceptives that then makes management overall of SRHR very comfortable. There's of course the challenge of intercadar war, where there's still the thought of why do they need to manage to take care of their health from the comfort of the home. But we are working with some of these cases that needs.
We have lost you, Nelly. We can't hear you.
Support. They don't necessarily need to come to the healthcare facility. Shobha, am I back?
Yes, you're back now.
Can you hear me?
Yes.
Oh, sorry.
Okay.
I'm sorry about that. Yeah, so, and I'm just wrapping up. So I'm saying that self-care becomes a change maker. And in terms of just ensuring that these services can be accessed to, but also in ensuring that the cost that comes with accessing safe abortion services is also significantly reduced, and also giving women the autonomy and the agency to be able to manage their abortion. I think convening such as this, even as we wait to celebrate ESAD, are very critical because they give us opportunity to learn from what colleagues are doing from across the globe, so that we are taking these lessons and taking them back and sitting together to be able to develop strategies that can work and ensure that no woman is dying because of something that is preventable, and holding the government accountable, ensuring that they are committing and implementing the commitments they've made to, but also the policies that are available to, ensure that women access services. So thank you so much, Shobha and team, for having me on board. And I'm also excited to be one of the judges for this year's Journalist Awards. And I can't wait to see how this will look like, and looking forward to connecting with all of us at ICFP. Thank you so much.
Thank you, Nelly, and have a safe flight. Thanks for being with us today.
Thank you.
I'm now
Thank you.
I'm now honored to invite our keynote speaker, Dr. Mabel Bianco, the well-known physician activist from Argentina. Mabel is founding president of FEIM, Foundation for Studies and Research on Women, and has worked relentlessly for advancing the feminist agenda, human right to health, and gender equality for several decades now. Welcome, Mabel. The floor is yours. And sorry for waking you up once again so early in the morning.
It's okay. Well, thanks to you, Shobha, and all the group there. I'm very honored to be with you today, this morning. It's early here, but very happy to be with you, and at least to share with you some of our efforts in Latin America and the Caribbean to have the abortion laws, and also as we define all the sexual and reproductive health rights in order that they are a unity. So they are not separate, they are related. And this is very important. And this is why it's so interesting that I didn't know that we have a contraceptive day. For me, it's a new thing. But well, so I must say that the 28th September is a very close to me, because this was established, the abortion day, was established in Argentina, in San Bernardo, in the feminist meeting in which we can organize with the group of the Latin American, the Women's Healthcare Network, with the Argentinian group working for abortion, and the Catholics for the right to decide. We organized in this meeting a session about abortion, and there we proposed to have the 28th September as a day to all be together fighting for the abortion right, safe abortion rights. That's what we want to mention. It's not the abortion, it's to save abortion, because this is the problem that we are denouncing as a great violation of women's rights specifically. So from this was for Latin America, but immediately the group working worldwide decided to make it the day for worldwide. So now we have that day in which we are claiming, and this is the problem. We are advancing, and now we are in the backlash. But doesn't matter. We know that this couldn't be eliminated. I want to be very short, telling you some about our story, about how we work. In the 1980s, it was created the network in Bogota. Colombia used to be a central country for us in Latin America and the Caribbean. And it was created the network, and the network was based in an activity that it was done from ISIS International, that they have a journal in which they started to publish every month about what happened in maternal mortality and morbidity in our region. As you know, specifically Latin America is a region in which we are Catholics, at least this is how we announce. Meanwhile, now is less and less important the religious and the Catholics, and now is growing the new Pentecostals religions. But at those time, when we started to fight, it was the Catholic, and the Catholic Church doesn't want to promote nothing about sexual and reproductive health. This is something that we need to recognize. So we started to denounce how the restrictive laws for abortion and sexual and reproductive health in our countries are creating these high mortality and morbidity rates of maternal death. And this was something that it was put on figures and disseminate. And this is why I think it's so important that when we are fighting, we need to have evidence base. And now we develop more papers and studies, but at those days, it was necessary to push the feminists and also the medical doctors about feminists, men and women, because they are not a problem of sex, is a problem of ideology, that to be together and to put information concrete and very clear in order we have this evidence base to demonstrate the association between these restrictive laws with these high rates of maternal mortality. So when we have to put the day, the issue is that we have been working hard in the preparation of the Cairo meeting, the International Conference on Population and Development in '94 in Cairo. And as you know, we obtained the recognition of reproductive rights, but we couldn't have the sexual rights, and we couldn't go further as we want in order to push more clear to advance in the laws and the proposal of laws to recognize safe abortion. So this was that formula, let's say, in which we agreed to have this in accordance with the laws and so on. So it's not so what we want, but this what we could have. So since Cairo and then Beijing, in Beijing, we obtained the sexual rights. So in between Cairo and Beijing, we have the sexual and reproductive rights recognition, but still no the issue to fight to change laws and make the safe abortion a reality for all women. This was a matter in which we continue fighting, and in most of our countries in Latin America, we create some kind of organizations, national organizations, promoting the safe abortion. In Argentina, we created what we call the network for safe abortion, and we have a theme that is very clear. We say we need to have comprehensive sexuality education to have the right to decide. We need to have sexual and reproductive health services to avoid abortion. And we need safe abortion laws to eliminate the death of women due to abortion. So these are the issues that we decided to work in the three. So we started to fight to have comprehensive sexuality education, and we passed a law that is for all schools. At the beginning, it was only for public schools, but later it was for all schools. So it's necessary that our children and also adolescents and young people, because it's for the primary, the secondary, and the university, needs to receive information on comprehensive sexuality education to have the possibility to decide. Because if you don't have the knowledge, what are your rights, you couldn't decide. So this was our first. The second is to make sexual and reproductive health for all accessible. So we fight 10 years since 92 to 2002 to have a national law in which we create the program in the National Ministry of Health in order to what? To have the program there, to have the money, the budget to buy the contraceptives and all things that are necessary, and to train our physicians and personnel to be able to inform and give services on sexual and reproductive health for everybody. So for us, it was a great activity. We created a group of 4 NGOs, in which one is my organization, in which we organize in all the country groups of women's rights, all together with young people, youth, and also health services, human rights organization, in which we involve them to be fighting for the implementation of this law. And we were 10 years following how it is, how they do that, because as you can imagine, we were a country in which we have no recognition of the needs to contraception, because it's a big country, so we need to have the people to have children as much because we need to populate. And we didn't take care how many women and children die due this law that's supposed to be promote something that is against, because they have many other problems on the health services at family level and so on. So we must fight against all this establishment. And for us, the relation and the alliance with the media was very, very important, because we helped, and also in after many years, in 2015, we have this movement of nevermore anyone dying for violence against women, no more femicides, and we included obstetrics violence as one issue in which they have no abortion laws allowing safe abortion for everybody is a way of violence, violating the human rights of women and young women specifically to be without any violence, and these are why they are suffering the consequences to have these restrictive laws. So we developed that movement, and we incorporate a lot of young people, and it's very interesting because our symbol is in green, and this is also associated for the more adolescents and the children itself, also with the care of the environment. So they were together fighting for the two, the care of the environment and the safe abortion. And they were very clear, making examples how they, as adolescents, they are suffering to have this restrictive law, and they have a great morbidity and also death in adolescence due to unsafe abortion. So it was so important that they make their own messages that help us to demonstrate how is it the problem and how far is it and how ignored is it. Now, what we did, we make a lot of noise. In 2018, we tried to pass the first law in Argentina. It was passed in the representative chamber, but not in the Senate. This for us is a lesson. What is the lesson? Is that in the Senate, they were the most pushing from the establishment and the church against abortion. So this was the way in which we, for the second time in 2020, when we approved the law, it was a proposal, and with the safe abortion law, it was recognized also the right of those that want to continue a pregnancy and they are in a vulnerable position to be supported. And this is the two laws that they were moving together. This was the way in which we could pass the laws. And in the Senate, where it's the most difficult, it was a great influence of the adolescents that push their parents or grandparents, pushing them how they are not voting or why they are voting against abortion. So this was a very positive. Where we are now, and I'm going to, with this, finalize, our government since December 23 is against all the women's rights. They destroy and eliminate the ministries of women, gender, and diversity, and they didn't recognize the women's rights and the difference because they say we are all the same. This is a backlash for us. But as we have the laws, they couldn't stop our programs. Meanwhile, they are not funding, and the national program is not having the same resources, and they are not training anymore, and so on. But still, we have the laws, and we have the right to claim if they didn't provide any care. And now the provinces, because we are a federal country, they are doing the best to be able to practice. And to finalize, I think the great success as feminists we have is to have medical abortion. Medical abortion is something in which we decide as women when, where, and how. So we have the pills, we use them, we decide when, where, and how. And this is really, of course, needs to be early in the first 12 weeks of pregnancy, or maybe 14 sometimes. But this is, I think, the most important issue for us, because we decided this is what we need to have. So I think I congratulate you for this active fight to have laws and access to everybody, and especially to adolescents and young women, because they are the most affected. We are fighting also here, but we are not in your but we have our way to fight. And I think in Colombia, Bogota this year, we are going to be able to all together push for that. And I hope we are going to win, because always the right to life is more important than the right to death. Thank you so much.
Thank you very much, Mabel. We salute your indomitable spirit for carrying forward this torch of gender equality and insisting upon that it is we who decide. That is very important. It is we who decide, because we are the ones who suffer if we do not decide properly. We are the ones.
Mm-hmm.
And thank you very much, and hope to meet you in Bogota So
Yes.
yes. Let's
And if we are not going to be there, we are going to be in our places
Yes.
fighting all together.
Yes, definitely. Yes, of course. We will keep on the fight. Yes. Thank you, Mabel. Thank you once again. And let us now hear from Dr. Suchitra Dalvie, co-founder and coordinator, Asia Safe Abortion Partnership, that is abortion rights in Asia. Welcome, Suchitra. Over to you.
Oh, thank you so much, Shobha. I'm really grateful to have an opportunity to speak at this forum and wonderful to see you back in your good energy and good health. I was wondering if it's possible for me to share a PowerPoint presentation. Would that
Yes,
be okay?
yes, please do. Yes, of
I
course.
thought it would just make a little change
Yes,
of
yes,
pace
yes.
as well. So
Yes,
thank
of
you so much.
Of course.
I'll just open the PPT. Sorry, give me 1 second. Okay, so thank you once again to Shobha and She and Rights for this opportunity. And thank you to everyone who's here. Good morning, good afternoon, good evening. It's very heartening to see so many people show up for a conversation on abortion rights. And as Shobha said, I'm coordinator of the Asia Safe Abortion Partnership, which is the largest safe abortion rights network in Asia. We have members across 25 countries. And we have a couple of resource materials, which I'll request Nandini to share in the chat for those who might be interested. So basically, what I wanted to talk to us about was really, I think the speakers before me have really done an amazing job of setting the context of the big picture. And it was wonderful to hear Mabel speak and to, really very inspirational, but also a reminder that this is a multi-generational advocacy work. It's not going to be solved by like the next conference or, one declaration from us or a couple of webinars. So I think we also need to be grounded in the reality of what is it that we are challenging? What are the structures of oppression against which we are all fighting, all of us in the social justice movements. So I came across this map and I want to start with this because, a very basic, simple thing like the planet we live on and the countries we live in, the map that has been taught to us doesn't really represent the countries in the way that it ought to. And I know that there is a movement happening in the African continent to recenter Africa and, with an appropriate size. So I always like to start with this to tell, that something as basic we probably learn in the 3rd or 4th standard in school, and that itself needs to be changed. So how much more has to be challenged by us? Here is another map which kind of challenges our way of thinking. So traditional map is based on the geographical surface area and the political boundaries. But these maps actually show us, I don't know if anyone can guess, but they show us the maternal mortality rate of each country. So it is really very disheartening to see, and I can speak again for my own country, which, appears to have development indicators which our governments like to claim are very progressive. But women are still dying in massive numbers during pregnancies, either due to at time of delivery and the other complications, but also in large numbers due to unsafe abortion. So it is in the context of this that, all of us are gathered here and talking about it. Here again is another map which is very important for us to recognize is these are most of these countries that you saw in the earlier map are also countries with a very critical shortage of healthcare providers. And we know that there is a multiple, reasons and historical reasons why this is so. But there are clearly, we can connect the dots as to why we are where we are right now. And of the multiple systems of operation, a couple of them I will talk about, and I think everyone in this room is very well versed. This poster that I found in somewhere, I just find it, I mean, it's funny because it's true. It says, are you feeling sad and depressed? Are you anxious, worried about the future, feeling isolated and alone? You might be suffering from capitalism. And I think this could resonate with a lot of us in the current context. So there's patriarchy, there's capitalism and colonization. There's an increasing movement towards fascism. There is, of course, ableism. There is the compulsory cis heteronormativity hegemony that we are all very much aware of. So what does patriarchy look like? What is patriarchy? It's a social organization marked by the supremacy of the father in the clan or family, a legal dependence of wives and children, legal and I would say also financial, and the reckoning of descent and inheritance in the male line. And most of the legal as well as all other structures that we see are really in service of protecting this particular foundational oppressive structure. And here are some examples I want to show you from India. the cover of this book, which says, "May you be the mother of 100 sons." So where people want girls to be born only so that they can marry and then have sons. So the woman is seen just as a kind of a conduit, to having more of the sons, because obviously a male child is something that people prefer. And there are these pills which you can purchase. In fact, they were available on Amazon till recently. It's a capsule filled with blood, which we can use to fake your pregnancy. So I don't know whether it's like the most amazingly creative counter to the existing culture, or it's a submission to the existing culture. But in any case, I think it's a very interesting example of what are the various issues that we are navigating when we start talking about abortion or abortion rights. Here is another advertisement I want to share with all of you. Can you imagine a unisex washing machine? Because washing clothes is not just a women's department. So when you see in context of what is happening in the socio-cultural or political arena around us, within which we are battling for something which seems like threatening the very foundations of all these structures, which is why we have so much pushback, which is why it is so difficult for us to get our political message sorted, because we are still not sorting out, like, is it okay for a man to use a washing machine, for example? Or, if a woman daughter is ready to get married, then obviously she needs to understand how to plan parties and kitchen equipment. And here we're talking about, big ideologies like autonomy, agency, self-leadership, etc. Then there is, of course, time poverty. So women are facing the burden of unpaid household work. A lot of it is also because of uncontrolled fertility and being forced into having, more and more children. On top of patriarchy, we have colonization. And I think everyone here in this room would be familiar with colonization and the context. And the whole move now to decolonization, indigenization, decriminalization, because we currently in Asia at least have the largest number of young people we've ever had in history. But unfortunately, these young people are growing up in an environment where there are still, crippling, obsolete laws of entrenched colonization with the penal codes, which criminalize abortion and miscarriage in many of our countries which have been colonized. Although the colonizing countries have gone on to have very much advanced and liberal laws, but we are still struggling to live our lives according to that. Then there is the whole dynamic of population politics where, countries in Asia are told that, oh my God, there's a population explosion, but no one's talking about the carbon footprint of the countries in the global north. Not only that, now we are seeing pro-natalism on the rise. So there are many countries in Europe, particularly, where populations are declining because of the declining fertility rate. And we know what happens when the populations decline is the market forces become problematic because you need labor. So countries like France or even Japan, and now, of course, the famous Mr. Elon Musk says civilization is going to crumble if people don't have more children, which means my capitalist structure is going to be dismantled if you don't have enough unpaid, ununionized labor. So we are fighting against that as well. There's a whole new sexual revolution about pricing of virginity, which and the traditional wives, which is again trying to bring women back into the fold of the older structures where they were submissive and under the control of the patriarchy. In this context, we're talking of autonomy, agency, and the pregnant body. uh, you know, and to quote Audre Lorde, who says there's no such thing as a single issue struggle because we do not live single issue lives. So even abortion, we must recognize is in the context of so many other intersectional realities that we have to navigate and even battle with. And these are just some images, again, very familiar to everyone in this room. I think child marriages, girls traveling like this for education, women still walking many, many long kilometers to get water, lack of access to healthcare facilities, people living with disabilities being marginalized, queer community not just marginalized, criminalized, facing a lot of violence, poverty as a result of refugee status, disasters, and where you live and what kind of facilities you have can make all the difference to how you live your lives. So in this context, I'll just talk a little bit about the work that we are doing as at Asia Safe Abortion Partnership, and which is to try and build the capacity, particularly of young people, to advocate for these sexual and reproductive health and rights, and abortion being at the very, very heart of this issue, because if a pregnant person cannot decide whether they want to continue the pregnancy or not, then the forced birth kind of traps them within all these oppressive structures, and the cycle can never be broken. So, who is to be held accountable for this? I think already the earlier speakers have said that the governments or the state, of course, has to be held accountable for this. But we are, as somebody who's involved in movement building, also becoming more aware of our responsibility as civil society to hold ourselves accountable. Are we really showing up with having capacity built in all the ways and dimensions that we need to, fight this battle, for want of a better word? And as a movement, are we evolving to hold positions of power in the face of the current state of polycrisis? So one of the ways we have done that, and we are familiar with the whole framework of reproductive justice, going beyond just choice and rights, but talking about, are there frameworks of justice which are allowing me to make these choices in a meaningful way? And going beyond, of course, equality, and we move to equity, but also empowerment. Like, how are we going to remove these barriers which are being faced by people who have these challenges? So we have set up our online academy, and I would urge any of you who are interested to please check. I'll request Nandini to post a link in the chat box. And because a person with a uterus is not just a uterus. They do have other aspirations and dreams as a human being. But unless they are able to control their fertility and take a decision on a pregnancy, which may be planned, which may not be planned, which may have been wanted, is now unwanted, unless they can make those decisions, they can never fulfill their potential as a human being, beyond just being a uterus. So really the question is, are we as a world ready for women's rights to safe abortion? And of course, the answer in many places is no. But this is our little space that we are creating with the academy. And we already have a very global group of learners in our first batch and second batch. And we would really, really urge you to join us, because we are also trying to build a community of solidarity where we are learning about the tools and the context so that we can fight this in a better way. So if you're interested, of course, the link is there. And once again, a huge thank you to Shobha and She and Rights, because I think spaces like this where we can share and inspire each other and learn from each other are so critical, because we know that such spaces are being, restricted by governments. We don't even funding, because it has reduced, we can't really always meet in person. So such spaces are extremely valuable. And thank you so much for your patient listening. And thanks again, Shobha. Thank you.
Thank you very much, Suchitra. Thank you for being with us today. We would, before we open for the question and answer session, we would request Suchitra, maybe first, since you're there already, to please give your message for the Safe Abortion Day, the Contraception Day, and for UNGA, followed by Mabel. We would like to hear your short messages for these two.
Okay. So my short message would be that everyone should have the right to control their body and to take the decisions of how they want to live their lives, unfettered or free from coercion and violence. And I think that is really very important to me, because I remember, I think Anand Grover had said that being forced into having an unsafe abortion is a kind of torture. So I think everybody deserves to be free from coercion and violence in order to be able to control their own bodies. So thank you.
Thank you very much. Mabel, can we have your message? Is Mabel there? It was very early morning for her, actually. I do not know if she's still there or not.
Okay, sorry, I need
yes,
to
yes.
unmute myself.
Yes, okay,
Well,
sorry.
I think we need to be sure for this Beijing Plus 30 and the UNGAs that we need to fight to be recognized that the women's rights include sexual and reproductive rights, including access to safe abortion. So we need to push that these are going to be respected in all countries. And this is something that we need to insist. This is not something we are requesting in order to be remaining young or good bodies. No, this is a right. And these rights is not, with these laws, we are not obliging the people to abort, but we allow those that needs to abort because they couldn't have, they are not at risk of illness or die. So this is something that we need to be clear. And we are pro-life, not those that they are against abortion. Those are not for the life of the women and the society.
Thank you.
This is my message.
Thank you very much, Mabel. Very, very important message. And Mabel, there was a question by Vankyo Neanda in the chat box on what strategies can be employed in developing nations where abortion is still criminalized. You have answered that question, but we would like if you could say it out aloud because many of our viewers are watching it on YouTube also, this program. So we would like them to hear also what you had said.
Well, what I said, what I answered to that is that in those countries, you need to develop an intergenerational and very broad alliances and demonstrate with testimonies what happened. Because one issue I didn't say is that those restrictive laws are based in an injustice because those that have the money to pay a safe abortion, they are not having any problem. But those that they couldn't pay that, and the adolescents and the young people are the most terrible one, so they need to have those services. If not, they are dying or they are becoming very ill. So this is the injustice. This is the way we need to make them understand what it means in terms of life and possibility to develop and to be real. Because if you oblige a young woman of 14 years old to be mother, you are making those girls eliminate the possibility to be to develop themselves. And this means for the poor people, but also for the people in the more high level status, because they are becoming mother, they need to stop studying, they need to take care of the children, and they are not developing as it needs to be. So we need to give this to let them know what it means, the reality, not about this theoretical. I think this is important, we need to have, but we need to convince, giving testimonies of the real impact of the life of the young women and adolescents. This is my...
Yes, thank you. Thank you very much. Suchitra, we have a question for you from
Yeah.
Swapna Majumdar. She is a very senior journalist from India. She says, despite abortion being legal in India, almost 67% abortions in the country are unsafe. How frustrating is this for advocates like you? Has any progress been made in the last decade? And if yes, how can it be accelerated?
Thank you so much. It's a very, very important question. It is incredibly frustrating. I have been in this field for about 25 years now, and it's very distressing for me. You know, every new study that comes up shows the same issues, same systemic issues, public sector, not responsive, private sector exploitative, women unaware, to the extent that ASHA workers' curriculum also doesn't always tell them very clearly that abortion is legal. However, there are many people who are collectivizing and creating movements. In fact, I am one of the co-founders of a newly created coalition for abortion rights and reproductive justice in India, where we've got members from across the country, and we're all trying to create a new conversation around this. But as you can imagine, with our current government scenario, you can't talk too much about human rights. There is a restriction on using foreign funding for certain conversations. So the work is happening. But I think it's a lot of it is under the radar now deliberately. Unfortunately, what we are seeing in India now is a lot of the anti-choice conversations happening, particularly religious groups who are coming out with street protests, saying that abortion is murder. So this was something we hadn't had till now. And from what we understand, a lot of these people have got energized after the Roe v. Wade was read down in the US. And they are saying that, we should also follow suit and take MTP abortions off from the legal code. And I think that's something we really have to, be cautious of, to hold the line. And if you would really like to know more in detail, please feel free to contact me. I would love to give you more information on this topic. Thank you.
Thank you. We have some very senior journalists with us today, Rita Vidyadana from Indonesia. Rita, would you like to share your thoughts on this, on today's topic? And we also have Kalpana Acharya from Nepal. Rita, we are waiting to hear from you. Yes, Peter.
Shobha, someone has their hand raised.
Yes.
I don't know if you can see the
Yes, yes,
screen.
yes, yes. Yes, Nahid. What would you like to say? Yes.
Thank you. And thank you for this very informative presentations. I'm Nahi Gabrallah, Director of SEMA Center for Protection of Women and Child Rights, a Sudanese organization. Now, after the war, we are operating from Uganda for both Uganda and Sudan. I think first I would like to make sure that this very good and important platform will not be hit and run. Let us agree or make something that we can continue this important work. For me, it is very interesting. In Sudan, we had in the Penal Code 1991 an article 135, that allow for abortion in 3 conditions. That if it is because of rape, and the second condition is if it is because of rape, or if there is risk to the mother, and the third condition is if the fetus is no more alive. But the very interesting thing, although it does not allow for the right of abortion as a right for the woman, but for very restricted cases, it was not enforced. And we are proud that SEMA, our organization, succeeded in doing the first abortion case procedure in 2022. The first abortion, because the law lacked the procedure in place for implementation, and because the law enforcement people and even women and all of people don't know about the law. So we challenge the law, and we succeeded in doing the case, the abortion for a 14 years old raped girl. For me, and we start doing some work on that, and but of course, because of the war, all stopped. But we succeeded in doing. I can share with you a report regarding a workshop with the participation of officials and activists on that. My point is that it has to do with the presence of the law, and the knowledge about the law, the information about the law for women, for activists, for law enforcement people, and challenging the procedure. I'm afraid that what all our activities regarding abortion is so close. It is like intellectual or activist issues. So we don't have the work on awareness raising, mobilization, and challenging the existing laws. Even in one of the presentation now, that Sudan was considered as one of the countries which has no laws that allow for abortion. I think it allows, but is very restricted. Another thing that I would like to add, after the eruption of war, of course, the war is evil, and we are against war. But we faced big mass cases of rape. Then the government, bear in mind, we had very strict Islamic groups, and the government was not that, it is a dictatorship. But because they wanted to reflect that this issue is from the militias, and they are supportive, now we succeeded, just for our organization, we succeeded in doing more than 14 cases of legal abortion. And I think it is a chance for us that to make use of this space to advocate of the exhaustion of the law and for the enforcing of the law, and to fight for better space. And this can be one of the battles that we have to make use of. Really, we lack the experience because it is not that wide regarding working on the issues of sexual rights, especially the issue of abortion. I think we can work together on that. And really, for me, although we are working for years in the field, I'm interested and got excited knowing that there is International Day for Safe Abortion. I would like to see the opportunities for working together to celebrate this day and to focus more on the issue of the legal abortion and right of our abortion. Lastly, I think it is very important to mainstream the issue of right to abortions with the other issues of reproductive health and reproductive rights, because now we tackle it separately. Each time it is not there when we talk about reproductive rights, which we have a big number of organizations, activists, and space to do with that. Thank you. And really, I'm so grateful for this opportunity.
Thank you very much, Nai. Thank you for sharing your thoughts and your country's stance on abortion rights, and also for the fight which you are putting up. So I think with this, we come to the close of today's session. My heartfelt gratitude to all our speakers and participants for their solidarity in our attempts to advance sexual and reproductive health and rights for all. And in that, safe abortion rights is an integral part of it. And for all of us, including gender diverse peoples. Once again, a reminder to all our media friends, if you are reporting on issues raised by SheN Rights during 1st July 2025 and 15th September 2025, please apply for the SheN Rights Media Awards. The first prize winners from Africa and from Asia Pacific region would get to go to the International Conference on Family Planning, or ICFP 2025. Thanks to Global Center for Health Diplomacy and Inclusion, or what we call CeHDI. And the application process is open till September 15, so 10 more days left to apply. And the link to apply is in the chat box. And goodbye and namaste. With the mantra, I think we should all aim for that gender inequality must end with us. I think that is what we need to do. Thank you very much for being with us today.